everyone, my name is Julia Hartley. I'm the Association Coordinator with the PEI Lung Association. Today is session number 4, Puffers and Medications, and we have 2 speakers on the call. We have, our first speaker is going to be Heather Sear, a respiratory therapist with Health PEI, and our second speaker is Craig Meek, who's a pharmacist with Murphy's Pharmacy. So we're going to start with Heather's presentation today. Heather went to Dalhousie University for her Bachelor of Science and Respiratory Therapy degree, and has now been working on PEI for over 20 years in the area of respiratory therapy. Her current role is a COPD educator with Health PEI's chronic disease team. So thank you, Heather. We're looking forward to your presentation.
Respiratory therapist, COPD coordinator for Health PEI. And today we're going to be talking about COPD medications. You'll see a pretty happy little slide here on the screen. They're happy, yes, they do positive things for those living with COPD. So we're going to talk a little bit more about each of those as we go along. And as you can see, there's a vast variety, and that makes things confusing at times. So hopefully by the end of the session, there is some clarity around these. Some points to review. Those of you that have joined into previous sessions will remember some of these. Shortness of breath is a common symptom of COPD. So everything we do in the treatment of COPD is to help relieve that shortness of breath. There are some non-medicinal strategies you can use. And again, these were touched on in some previous sessions, and I would encourage you to go back and look at these if you missed those. Pursed-lip breathing, body positioning, posture, coughing techniques can also be used to manage shortness of breath. And in general, we do want to try to avoid inhaling any substances known to cause shortness of breath. And that would include cigarette smoking. We all know our own triggers, so those are the things that you want to learn and try to avoid going forward. So the pulmonary medication types, and pulmonary, refers to lungs. We're going to talk about bronchodilators, anti-inflammatories, antibiotics, and vaccines. There are some others that we won't touch base on today, but we may mention those again later. So bronchodilators, if we look here to the right, can you guys see this, the picture here of the airways? Everybody's muted, so they can't tell. So the first picture here is indicative of what a normal airway looks like. So an airway is surrounded by muscle, and that black part that you see in the middle is that's where the air flows through. I'm not sure if you can see that. Maybe. There we go. So this part here is where the air flows through. Around that is the lung tissue. Now, when our lungs are in spasm, a couple of things happen. The muscle surrounding the airway tightens, which the end result of that is that there's less space within the lung for the air to move through. Also, what can happen is that tissue in the airway becomes inflamed, and there may be mucus production. So this is a much smaller space for air to flow through than a normal airway. So what a bronchodilator does, and that's a really fancy term, but essentially what it means is it's going to open the lungs, open that airway. So it relaxes the muscles surrounding the airway, which results in the airways being larger, allowing for the air to move through a little more easily. And it relieves that feeling of shortness of breath, chest tightness, and wheezing. So we're going to look first at short-acting bronchodilators. There's quite a variety. I believe most of you would be accustomed to seeing Ventolin, this blue puffer, and this is referred to as an MDI. There's a lot of different types, and we're going to get into those as we move forward. So what these do is they open the airways quickly. They can help reduce shortness of breath and wheezing, and they typically will last for 4 to 6 hours. So again, short-acting. We also have inhalers that are called long-acting, and again, quite a variety of those. So these will last between 12 to 24 hours. So because of that, we will take these either once or twice a day. They are considered maintenance puffers, so you will take these every day. And talking about bronchodilators, there's so many options. We also have inhalers that have more than one type of bronchodilator in one. So we have, in these particular ones you see on the screen, there are 2 different types in each one of these. Every medication we take is not without side effects. So here are the few that you might expect to see with a bronchodilator. You may feel tremors, so a little bit shaky. Your heartbeat might race a little bit. That's how mine's feeling right now, unrelated to a bronchodilator. You may have a headache, nervousness, or flushing. Other side effects may include a dry mouth. You may have a bitter taste in your mouth afterwards. And you may also experience eye irritation. So some ways to avoid those would be to rinse your mouth out after you take your medication. And in terms of eye irritation, always wash your hands when you finish using your puffer, just to make sure there's no residue left on your hands, because hands do go to the eyes fairly often. The next type of medication we're going to touch on is called an anti-inflammatory medication. And we are still talking about inhalers. So what these do is they reduce that inflammation, that swelling inside your airways. So as that swelling is reduced, again, it's going to allow for more space for the air to flow in and out of the lungs. In COPD, anti-inflammatories are always prescribed in combination with a bronchodilator. So the bronchodilator is the most important piece, and we will add anti-inflammatories to some medication regimes. It's not for everybody, and in working with your nurse practitioner or physician will help determine which one works best for you. They do have to be taken on a regular basis to be effective. Regular basis. So you do take these every day. And these ones, it's particularly important to rinse your mouth out after taking it because it can cause a thrush or a yeast infection in the mouth. So speaking of combination inhalers, again, quite a large variety of those available on the market. So this is a bronchodilator and anti-inflammatory combination. I don't want you to get too caught up in the options that are available. The focus today is to really look at what you are currently taking. Prescriptions are based on individual needs. So as we talk about a medication that you are taking, I really want you to focus your efforts on those. And just for the purpose of today, try to kind of not think about the other ones because it can be confusing if you try to think of, how do I take that? I'm not currently taking it. We're just not going to worry about those for today. So in terms of anti-inflammatories, the most common side effects we would see would be a hoarse voice, a sore throat, or again, the thrush. In high doses, and this is not very common, you might see bruising, osteoporosis, or cataracts. If you're having side effects to any of these medications that you're not comfortable with, please reach out to the person that has prescribed them, so your family doctor and nurse practitioner, and they may be able to make adjustments in the medications so that you have fewer side effects. This is an interesting question. What % of people use their puffer correctly? Now, the first time I saw this question, of course, I had a preconceived answer in my head, and boy, was I wrong. And I think this is going to shock a lot of people. 10%. So 1 in 10 people are using their medication, their inhaler, properly. That was mind-blowing to me. So that tells me that we have a lot of work to do in terms of teaching people and ensuring proper use. So what is the downside to using your puffer incorrectly? First thing is you're not going to receive the proper dose. If you're not receiving the proper dose, your disease is not going to be controlled as well as we would like. This can lead to exacerbations or flare-ups, and can also result in more visits to the emergency room, and for some people, hospitalizations. So these are all, pretty big concerns, and not to discount the waste of the money. You are paying good money for these medications, and if you're not receiving the desired effect, it's one more downside to it. So look at this screen. This is pretty cumbersome for a lot of people to look at. This is an overview of all of the medications that we have available for COPD. Actually, I'm lying, there's one missing. So all of these plus one. So is it any wonder that people are confused about how to take their inhaler? It's not uncommon to be on multiple types of devices. Very common. In general, the fewer that you're on, the better. And we did speak earlier about how many different combination therapies there are out there. So if you are in a situation where you're taking a lot of different devices, it's a good idea to talk to your family doctor or nurse practitioner about possibly changing those to something that is a little less cumbersome, just down to one type of device or two at most. So MDI with spacer, that's the first thing we're going to talk about. And most people would be familiar with this device here. Ventolin puffery would be blue. Mine is just a placebo, so it's in the white color, and the spacer. So if you take home no other message today but this one, I really, really, really want everybody to focus on how to take this. And I'm going to play a short video here in a moment. This is considered a rescue inhaler. If you are breathing, you can take this medication. So when you're feeling short of breath, this is the go-to drug. So, and this is for both asthma and COPD. So again, pay particular attention. Here we go.
Remove the caps from both the inhaler and the spacer. Shake the inhaler. Insert the inhaler into the spacer. Breathe out. Seal your lips around the spacer mouthpiece. Press the inhaler down once and breathe in slowly and deeply. If you hear a whistle, you're breathing in too fast. Remove the spacer and hold your breath for 5 to 10 seconds. Breathe out. If another puff is required, wait at least 30 to 60 seconds and repeat all these steps. Replace the caps and then rinse your mouth with water. Please note, if you are unable to hold your breath, take 6 normal breaths instead.
So that is a really important message. When you're feeling short of breath, it can be very challenging to hold your breath. Don't worry about that. As long as you have that mouthpiece in your mouth and you're breathing, you will get that medication. This is called a holding chamber. The medication is there. Just keep breathing. And again, 5 to 6 breaths. Always rinse your mouth after you use the inhaler, and do not spray more than 1 puff into the chamber at a time. It's 1 at a time, and always wait that 30 to 60 seconds in between. The next device we're going to talk about is the Breezhaler.
Pull off the cap. Tilt the mouthpiece open. Remove a capsule from the packaging and place in the capsule chamber. Close the mouthpiece until you hear it click. Hold the Breezhaler upright and press the side buttons once and release. Breathe out, away from the Breezhaler. Seal your lips around the mouthpiece and breathe in quickly and deeply. Hold your breath for 5 to 10 seconds. Breathe out. Open the mouthpiece to see if there's any medication left in the capsule. If there is, follow these steps. Breathe out away from the Breezhaler. Seal your lips around the mouthpiece and breathe in quickly and deeply. Hold your breath for 5 to 10 seconds. and breathe out. Open the mouthpiece and dispose of the empty capsule. Replace the cap and ensure you wash your hands.
So we did talk earlier about trying to avoid contact with the eyes with the medication. I don't really like the idea of dropping that capsule into your hand after you've used it. The best advice is to open it, drop it in the capsule into the garbage, and still wash your hands when you've finished. In terms of maintenance for the Breezhaler, you just want to wipe the mouthpiece with a dry tissue. Always keep it dry. It is a powder that's within the capsule, so if there's a lot of moisture within it, it might kind of gum up that medication and make it difficult to inhale. Next up, we're going to talk about the discus.
Slide open the discus. Slide the lever over until you hear a click. Breathe out, away from the discus. Seal your lips around the mouthpiece and breathe in quickly and deeply. Remove the discus from your mouth and hold your breath for 5 to 10 seconds. Breathe out. Close the discus and repeat these steps if required. Then rinse your mouth with water.
So again, you want to keep the discus dry. There is a powder inside of that one as well. Wipe the mouthpiece with a dry tissue or cloth. The discus does have a counter. It's really difficult to see here on the screen, but as it approaches 0, you want to be thinking about having your prescription refilled. And next up is the Ellipta.
On first use, you will have to open a foil tray and remove the inhaler. Discard the packaging and tray. On the inhaler, write the date the package was opened, as well as the discard date for 6 weeks from opening. Slide open the cover. You should hear a click. Breathe out fully, away from the mouthpiece. Seal your lips around the mouthpiece and take in a long, steady, deep breath, ensuring you do not block the vent with your fingers. Remove the inhaler from your mouth and hold your breath for 5 to 10 seconds. Breathe out. Close the cover and rinse your mouth.
Okay, so once you've opened the cap, the medication is released. So if you don't inhale that, your medication is lost. Okay, so it's an important thing to remember. Once it's open, it's ready to be dispensed. Make sure you inhale it. Keep it dry. Again, it is a powder inside. Wipe the mouthpiece with a dry tissue or cloth. It also has a counter, and it will count down, and as it approaches 0, it too is empty. Next up is the Handihaler. Be a lot of people out there familiar with this one.
Open the dust cap and mouthpiece. Remove a capsule from the packaging and place in the capsule chamber. Close the mouthpiece until you hear it click. Hold the Handihaler upright and press the green button once and release. Breathe out, away from the Handihaler. Seal your lips around the mouthpiece and breathe in slowly and deeply. Remove the inhaler from your mouth and hold your breath for 5 to 10 seconds. Breathe out. We'll repeat the previous steps to ensure all the medication has been taken. Breathe out, away from the Handihaler. Seal your lips around the mouthpiece and breathe in slowly and deeply. Remove the inhaler from your mouth and hold your breath for 5 to 10 seconds. Breathe out. Open the mouthpiece and dispose of the empty capsule. Then close the mouthpiece and dust cap. Ensure to wash your hands after using the Handihaler.
And again, I would encourage you just to drop that capsule into the garbage. And you can clean your Handihaler about once a month just with water. They don't encourage soap with this, and make sure it's dry before you use it. And next up is the Turkeyhaler.
Hold the inhaler upright and twist the cap off. Turn the base in one direction and back until you hear a click. Breathe out away from the Turbuhaler. Seal your lips around the mouthpiece and breathe in quickly and deeply. Hold your breath for 5 to 10 seconds. Then breathe out. If you need a second puff, repeat these steps. When you're finished, place the cap on, twist to close, and then rinse your mouth.
So again, another powder inhaler. Make sure you keep it dry, and cleaning instructions are the same. Wipe with a dry tissue or cloth. And it also has a counter. Love the counters. So once it approaches 0, that means that it's empty. And we're off to the Genuaire.
Remove the cap from the inhaler. Press the colored button all the way down and release. Check that the color control window is green. This means that the inhaler is ready. Breathe out fully away from the inhaler. Seal your lips around the mouthpiece and breathe in strong and deep. Keep breathing in even after you've heard the click. Remove the inhaler from your mouth and hold your breath for 5 to 10 seconds. Breathe out. Check that the color control window has turned from green to red. This tells you if you have inhaled correctly. If the window has not turned red, breathe in another strong, deep breath. Then replace the cap.
Okay, so this also has a counter on it. We're going to wipe that with a dry tissue or cloth as well, and 0 is empty. Next up is the Respimat.
The Respimat device comes in 2 pieces, the inhaler and a medication cartridge. Before it is used the first time, it will need to be assembled and primed. With the cap closed, press the safety catch to remove the clear base of the inhaler. Push the narrow end of the cartridge into the inhaler as far as it will go. Place the inhaler upright on a firm surface and push firmly down on the inhaler to ensure the cartridge has gone all the way in. Put the clear base back into place. To prime the inhaler for use, hold the inhaler upright with the cap closed. Turn the base in the direction of the arrows until it clicks. Flip the cap open. Point the inhaler down and press the dose release button. Close the cap. Repeat this 3 more times. Now to use the inhaler, follow these steps. Hold the inhaler upright with the cap closed. Turn the clear base a half turn in the direction of the arrows until you hear a click. Flip the cap open. Breathe out fully and slowly. Close your lips around the mouthpiece without covering the air vents. Point the inhaler towards the back of the throat. While taking in a slow, deep breath, press the dose release button and continue to breathe in slowly. Remove the inhaler from your mouth and hold your breath for 5 to 10 seconds. Breathe out. Close the cap, and if another dose is required, repeat these steps.
Okay, so in PEI, you will find that most pharmacists do pre-assemble this device for you. So when you pick it up from the pharmacy, it most likely is going to look like this. What probably hasn't been done is the priming. So that is an important thing to discuss with your pharmacist. And Craig, who is a pharmacist who will be speaking with us later, he may be able to comment on that, about the priming piece. So you saw that first spray, really nothing came out. And as the subsequent puffs came out, there was a little bit more. So it's really important to follow those instructions. Cleaning is the same, just wipe with a damp cloth actually for this one. And it does also have a counter along the side. So as it approaches empty, just make sure that you arrange to get a new one from your pharmacy. Oh, here comes the live demo. The Lung Association hasn't yet produced a video for this one, so bear with me. This is called an InHub, and it is a relatively new device. Some of you may be prescribed it. It's a generic drug, so it is being used a little more frequently here in PEI. So how we use this, there's a little grooved section here that we're going to hang on to. We're going to open this up. This is what it looks like when it's fully open. There is a little lever here, it's yellow, and we're going to push that all the way down. You're going to hear a click. So it's ready to roll. And similar to the other dry powdered inhalers, you're going to exhale fully, pop this in your mouth, take in a deep breath, and hold for 10 seconds. So I'll attempt to do that now. And release. And that's it. Once you've completed, you're just going to close the cap. And again, there is a counter on here, so we know when we are approaching 0, it's time to look at a replacement. Success. Okay, so let's carry on. Actually, I'm going to pause for a moment because there are a couple of things that I forgot to mention about the MDI and spacer. I did mention that this is one of the most important devices you will have in your regime. So what I forgot to mention is that you do want to clean this spacer on a regular basis. The back comes off, the front comes off. You're going to wash those with warm soapy water, rinse them and let them air dry, and that's about once a week. Another really important part that I forgot to mention is this empty. As I spoke about the counters and the other devices, what I failed to mention is that these ones do not have counters for the most part. So if you take the canister outside of the sleeve and you give it just a gentle shake, you can actually feel the medication swooshing back and forth. If you feel medication in there, you're good. You do have enough. Unfortunately, a lot of people run out of these and they don't recognize that they've run out. They reach for them when they're having trouble, having shortness of breath. It doesn't work. It doesn't work because it's empty. So pay really close attention to that. Make sure you always have one that has some puffer in that, as not empty. So there are some other medications that we use for COPD, and these aren't used on a regular basis. But if you have a flare-up or what we call an exacerbation, oftentimes you're going to be prescribed prednisone. Now, those of you out there that have an action plan, and those do exist for COPD and asthma, this is a very common drug to be placed on. And we spoke earlier about anti-inflammatories, which is what prednisone is. Prednisone acts very quickly to reduce the inflammation in the lungs. And again, used for COPD exacerbation, and is typically prescribed for short term, 5 days. So essentially what you're doing is you're reducing that inflammation, allowing your body some time to start healing from that flare up. If it is felt that you have a respiratory infection in your lungs, so a pneumonia, they may also add antibiotics to your treatment. And again, this is not something we're looking to do on a routine basis. This is specifically for a flare-up. So if you're having a lot of difficulty with your breathing, increased shortness of breath for 2 days or more, increased sputum production for 2 days or more, you would want to look at treatment for this. If you don't have an action plan, if these medications readily available for you, please reach out to your nurse practitioner or your family doctor to be seen in a timely manner. If you can't breathe, of course, always go to the hospital. We hope to not, that the goal is for you to not have to visit a hospital. So we like to have these things in place so that you can self-manage your disease. And we're going to talk a little bit more about that in a moment. So in general, most of what I spoke about today was about taking your medications correctly. It does help settle your shortness of breath. Know your medications, know what you're on. Make sure you take notes when you're getting instructions. Ask questions when you visit your physician, your nurse practitioner, or your COPD clinic. If you don't understand completely, ask again. Repetition is the key. Be sure you fully understand. Remember that 10%. Only 10% of people understand how to use their inhalers. If you find yourself on too many types, you're on 3 or 4 different types, please speak to your doctor or nurse practitioner and see if you can get that switch so that you're only taking 1 or 2. And your pharmacist too is a great resource. They're the ones that are going to be passing the medication to you. So typically they will review how to take them at that time. And don't be afraid to ask. Please, please, please. So for those of you that have not been to a COPD clinic before, this is a link that will help connect you. www.healthpei.ca/COPD. We have clinics across the island. It shouldn't be a barrier for you to see somebody. They're all the way from Surrey right straight through to Alberton. So if you have not connected with one of those yet, please reach out. If you're not tech savvy and the internet is not your thing, ask your family doctor or nurse practitioner. You can self-refer. You can call them and make your own appointment. If you have a diagnosis of COPD, you can reach out, connect with them, and they will help you manage your disease. They will work with your doctor, your nurse practitioner, to make sure all those medications we just spoke about, that you have exactly what you need and that you know how to use them, amongst a lot of other wonderful things. So I would encourage everyone to reach out. And that ends my portion. So I'm going to turn this back to Julia.
So our next speaker is Craig Meek. He's a registered pharmacist who's going to speak about vaccinations that are recommended for patients with COPD. Craig Meek received a Bachelor of Science in Pharmacy from Dalhousie University. He's been practicing on PEI for over 15 years with Murphy's Pharmacy and is passionate about helping islanders with lung disease improve their quality of life. Craig is also a talented musician and plays in a band, Wrong Planet Band. So go ahead, Craig.
That term, talented, loose. Thank you, Julia. I'm going to touch a little bit on the vaccinations recommended in patients with COPD, but Heather had mentioned just one thing before I get started about the Respimat device. It's important to talk to your pharmacy team. We can, as she said, we can either prepare the inhaler and prime it for you, or some patients prefer not to have that done. They prefer to do it on their own. So as long as you speak with your pharmacist or your pharmacy team just to let them know how you'd want that, if you want to prepare it or not. And it's certainly, things have changed in light of COVID-19, and we try to minimize the handling of inhalers and other devices without patients' permission, certainly. So yeah, just let us know, and and we can do it or not do it, however you want. So that's a good question. So yeah, we go to the first slide there. So Heather talked a lot about COPD, and she mentioned flare-ups or exacerbations. So what I wanted to get into was a little bit about vaccinations. Certainly flare-ups and exacerbations can be caused by things out of your control. So whether it be exposure to someone who smokes, certain allergens, even a change in the weather, that can happen. But a lot of exacerbations are caused by exposure to viruses such as influenza, COVID-19, and bacteria. So I just want to touch a bit on vaccinations that can reduce your chance of contracting certain illnesses or infections. And go to the next slide. Okay. Yeah, so again, like I was saying, there's research that shows that vaccination can prevent and reduce your chance of a flare-up or an exacerbation. So not only the obvious about improved quality of life, but also admissions to hospital, ER visits, admissions to hospital, and just an overall decrease to the healthcare costs. So, all right, so I'm going to touch on 3 vaccines that we've probably all heard of. I suppose vaccinations have really come into light this past year with COVID-19 more so than ever. So it is really good that we're talking about vaccinations, especially for patients who have COPD. So I'm going to talk a little bit about the influenza vaccine or the flu shot, the pneumococcal vaccine, or the pneumonia vaccine. And then at the end, I'm going to get into a little bit about the COVID-19 vaccination. One thing I wanted to note too is not to disregard other routine vaccinations. So it's important to be up to date with certain vaccinations, even such as your pertussis vaccination or a measles, mumps, rubella vaccination. So I know public health are busy these days with the vaccine rollout with COVID-19, but you can always contact public health to check your records. You can check with your family doctor just to make sure, it isn't time for a tetanus shot or a pertussis or a whooping cough shot. So that's important too. All right, so the first one, nothing new that you haven't heard about before, the influenza vaccine or the flu shot. I think we do a fairly good job of pushing that each year. Certainly we've vaccinated more people than ever this past year. It's the first one I wanted to talk about. So obviously the flu, yeah, it's a viral infection, most commonly occurring during the winter months. So it attacks and damages the respiratory tracts, which obviously for patients with COPD, that can be quite severe. You're at an increased risk of severe illness, hospitalization, and possibly even death if you acquire influenza. So it's very important to get your yearly flu shot. Let's go on to the next one there. Perfect. So yeah, it's a yearly vaccine. The flu virus changes, mutates annually. So we don't have a one-shot for life flu vaccination, unfortunately, but it's a fairly easy thing to do, and it's a yearly shot. Usually available in October, although this year we were fairly lucky to get the supply in mid to late September. So we were able to vaccinate Islanders earlier than ever, which was great. Generally, vaccines are very well tolerated. The flu shot or influenza vaccine, the most common side effect or adverse effect I'll mention with these vaccines is injection site pain or swelling or redness. So that sore or stiff arm that you see for the first day or so. Smaller percentage of people have some issues with headache or aching muscles or fatigue. Which is, you're not getting the flu when you get a flu shot, but it's your immune system, a response to your immune system producing defense or antibodies to to the virus. So they usually subside over the first day or so, and it's usually minimal. So I think it's an easy thing to deal with when you think about the protection it offers you. So that's the first one we've all heard about before, the flu shot. Now moving on to pneumonia, or the pneumococcal vaccine. Pneumonia, so it can be caused by viruses, bacteria, and also fungi or fungus. This, similar to influenza and COVID-19, is contagious and infectious and can be passed on person to person through close contact via droplets, which is a term we've certainly heard a lot about in the past year that we maybe didn't hear about a whole lot before. Common signs and symptoms, there are quite a few depending on whether one acquires community-acquired pneumonia or hospital-acquired pneumonia, but usually fever, fatigue, muscle pain, and then certainly with respiratory issues, cough with or without mucus. And COPD patients are certainly at an increased risk of acquiring pneumonia because of your pre-existing condition. So a pneumonia shot or pneumococcal vaccine. The next one. Perfect. So this is a vaccine that's available. It is protection, or provides protection against various pneumococcal bacteria that cause pneumonia. There are two shots or two vaccines available now, one called Prevnar 13, one called Pneumovax 23. The vaccination schedule differs depending on your age, depending on pre-existing conditions, if you're at higher risk. It is part of the immunization, the childhood immunization schedule. But adults later in life, especially those over the age of 65, should look into getting a pneumonia shot or the Pneumovax 23. For Islanders over the age of 65, this is free. It's provided at Public Health. You can also get it from your pharmacy, although there may be a charge. But yeah, it's something that really you should look into, and I would suggest any patient who has COPD to contact either Public Health or your family doctor or your pharmacy for more information if you don't already have this vaccine or haven't been vaccinated against pneumonia. So moving on, last but certainly not least, newsmaker of the year, COVID-19. We've all heard so much about COVID-19, of course, and this infectious virus that attacks and damages the respiratory tract. Also, as you know, very contagious via close contact, spread via droplets, brought on by symptoms that overlap a lot with influenza and pneumonia, such as fever, dry cough, fatigue, headaches, loss of taste and smell. COPD patients, as with influenza and pneumonia, are at a higher risk of experiencing more severe symptoms and illness from COVID-19 because it affects the respiratory tract, your nose, throat, and lungs. It can possibly lead to pneumonia and acute respiratory failure as well. So the COVID-19 vaccination, fortunately, this was a vaccine that was developed, several vaccines that were developed quite quickly. The program is certainly underway here in PEI. You can get more information by calling the number listed on the screen there, or if you have access to the internet, which anyone joining us today does, you can get more information on the PEI government website. There's all kinds of information about the rollout, who's being vaccinated and what time frame. The two vaccines that are approved in Canada right now for COVID-19, there's one by Pfizer and there's one by Moderna. These both require 2 injections for 2 doses. The efficacy, as you probably heard, is quite good, is quite high, is around 95%. And both of these, depending on which one you get, there's a certain amount of time that has to pass in between the 2 injections. The Pfizer vaccine is 21 days between dose 1 and dose 2, and the Moderna one is 28 days. And there are certainly many more vaccines that are waiting to be approved certainly one by Johnson & Johnson and AstraZeneca, just to name a couple. But for now, we're lucky that there are 2 on the market. So yeah, so the program is well underway. And anyone who wants to have a vaccine will get one. The goal is to vaccinate 80% of the population, but any islander certainly who wants to get a vaccine will get one in 2021. The side effects, here's some information or talk about side effects, unwanted adverse effects. I think there's just been a lot of attention on the COVID-19 vaccine, and there's been some talk about anaphylactic reactions and adverse effects. This is certainly something that can happen with whether it be a flu vaccine or a pneumococcal vaccine. The sore arm that I mentioned, the chills, fever, body aches, fatigue that can happen. This is short-lived and usually very mild. And again, I think it's an easy trade-off for providing protection against something that could be quite serious for anyone, let alone someone with a condition such as COPD. So that's it, really. That's what I wanted to touch on rather. Just mainly reiterating and reinforcing the importance of getting yourself vaccinated against influenza, pneumonia, and COVID-19.
Great, thanks a lot for your presentation today. So we are going to end our session for today. If you have any questions, please call us at the Lung Association. Our number is 902-892-5957, and our website is pei.lung.ca. Great having everyone join us today, and look forward to next session. Thank you.